All right, we're going to go ahead and get underway. I want to welcome you all here today. My name is Dan Worry. I am the Director of Early Learning at the Hunt Institute in Durham, North Carolina, and I want to welcome you to what is, I believe, the fourth installment of our Early Childhood Philanthropy Amidst COVID-19 series. We've got a great panel of funders here today to talk about their work during this unusual time, and we'll introduce them in just a moment. But before we do, I want to introduce you to the President and CEO of the Hunt Institute, Dr. Javed Siddiki.
Thank you, Dan. Make sure I'm not on mute. Yep. Thanks, Dan. Good afternoon, everybody. Thanks for joining us this afternoon. As Dan mentioned, this is I want to welcome you to our Supporting Innovation in Education series. Today's session is specifically focused, as Dan mentioned, on early childhood. As you've probably gathered from the session title, we've created a series in part to allow our philanthropic partners to talk about their work under the unique set of circumstances created by COVID-19. But as you all know, because you live in the same world as I'm living in, there are other important things happening that play into these conversations. We're reckoning with racial justice and equity. We're in the midst of an unusually divisive moment in our politics. I think there's an election around the corner. Hopefully you've been paying attention. So the real issue here isn't necessarily just COVID, it's how we are adapting to meet the needs of children and families during a unique and stressful time. I know all three of these panelists personally and professionally, and I know they have a lot to say here. So Dan, I'm gonna turn it back to you to get our conversation going and introduce our guests.
Javed, thank you. And we do have a terrific panel of friends and colleagues today. I want to introduce you to Dr. Rebecca Gomez, who is Program Officer at the Heisen-Simons Foundation, Dr. Jacqueline Jones, who is President and CEO of the Foundation for Child Development, and Dr. Michael Weinberg, who is Early Childhood Policy Officer at the Thornburg Foundation in New Mexico. It's great to have all three of you here with us for what I know is going to be an exciting conversation. I've already received a fair number of questions from the audience. Let me say to those of you who are viewing today, if you have questions that you haven't already submitted, you can do that in the chat, and a little bit later on in the conversation, we will pick up the thread and start talking about some of your questions. But we'll want to kick things off today by giving each of you a chance to really talk about the current circumstances of your work. As Javed mentioned, we're struggling through not only COVID, but a renewed conversation around racial equity and justice. We have a pretty contentious national election going on. So it's an unusual point in time. 2020 has been an unusual year for sure. And so I want to give you a chance by way of opening to just reflect a little bit on what you and your foundations are exploring and re-examining and maybe doing a little bit differently during this time, and what, if any, insights you have gleaned in the process. And Rebecca, why don't we start with you and let you share a little bit about the Heisen-Simons Foundation.
Great, thanks. Thanks, Javed and Dan, and to the rest of the Hunt Institute team for having me. I'm really pleased to be here, and thanks to all of you who took some time out of your schedule today to join us. As Dan mentioned, I'm a program officer with the Heisen-Simons Foundation. We're a family foundation located in the Bay Area in California. We have offices in Los Altos and San Francisco. We do fund nationally as well as specifically in California in early childhood education and other really, I think, critical areas like climate change and foundational science and human rights. But for our education program, we have a racial and income equity strategy, and we built that strategy out in 2018. It was approved by the board in late 2018. And we've been thinking about how to operationalize that in our grant making even before the pandemic hit. But I think the pandemic and what we've seen in terms of a struggle for racial justice has only amplified our thinking here. I'll start by sort of giving you our North Star, which is that by 2044, when the country reaches majority people of color status, we know many states and communities are already there, but by that time, we hope that our grant making will have contributed to an elimination of the opportunity gap. So that's our sort of long-term overarching goal. And the way that we try to do that through our grant making is by funding policy advocacy, grassroots organizing, and efforts to change early childhood systems. You know, and in particular, some of our work with the Hunt Institute focuses on governance and financing in states, right? We're also focusing on, and this has been a long interest of our board and the family, areas of effective practice in early childhood that really make a difference and that are sort of under focused on, right? So for example, early math. So that's a overview of our strategy, and I think sort of foundational in our thinking to your question, Dan. You know, when the pandemic hit, we sort of just responded as quickly as we could in getting augmentations out to our grassroots organizing and policy advocacy grantees, as well as other grantees who are helping early childhood providers and families think about the switch to remote learning. So I think one of the things that the Heisen-Simons Foundation prides itself on is the ability to be nimble. And we just got general support grants out to our grantees super quickly. We also started doing things like, you know, waiving final reports or, you know, extending the time for reports, right? And then converting grants to general support, like recognizing that especially right now, grantees needed a lot of flexibility. They needed to be responsive with their own funds, and that the best thing that we could do is sort of support that and then give them maximum flexibility and step out of the way. With regard to, you know, the ongoing struggle for racial justice, I think this is something that we've been aware of as a team for a while, and thinking about it, you know, in particular related to the early childhood workforce, as well as young children in this country, right? We have income and racial disparities. We have a racialized wealth gap. And so in our grant making, with the encouragement of our board, we had already started to shift towards funding groups that are most affected by these issues and taking a funding stance that is really like a trust-based philanthropy stance, I would say, and sort of saying, you know, we're making the grant to you and we trust you to know how to best use it to support the kids and families on the ground and the early childhood workforce. You know, in addition, we have other work that we're doing in collaboration with other funders, including the Foundation for Child Development, that takes a very long-term strategic approach to stabilizing and supporting the early childhood workforce. I'll talk more about that, I think, later in the webinar. But those are some of the things that I think we're doing. And I want to say, I have at this point more questions than answers about what the future will look like. I think we might know a little bit after next week. But, you know, philanthropy still has a lot of, I think, work to do on itself. You know, when we think about the notion of white supremacy as an overarching structure for the society that we live in and how to dismantle that, I think philanthropy has a role there. And I think we have a lot of learning and growing to do. And that's something that our foundation's talking about, our team's talking about. We by no means have it all right, but wanted to sort of flag that we're having those conversations. They're not easy, but they're very necessary.
Rebecca, thank you. And I suspect I'll speak for the rest of the panel in saying you're not alone and not knowing what the future will hold. I think you know, over and over here over the past year, we have all been in places where we have thought, well, you know, surely by summer this will be over, and surely by Thanksgiving this will be over. So it definitely is dragging on a little longer than we thought. Dr. Jones, let's turn to you and talk a little bit about the Foundation for Child Development.
Sure. Thanks, Dan, and thank you so much for giving us the opportunity to talk about our work. And thanks for all the folks who, as Rebecca said, took the time to join this conversation. The Foundation for Child Development is a small independent foundation based in New York City, but we are national in our funding. We've been around for over 100 years, and we fund research, which makes us a little different from a lot of places. But we fund research that we hope will have an impact on policy that will in turn have an impact on the lives of young children and their families. So we are in the middle, literally in the middle of a 10-year strategy to support the early childhood workforce. And we're looking at three big areas of work, and those are professionalization of the field, improving the quality of practice through implementation research, and then trying to really improve the quality of teacher preparation for early childhood teachers. when the pandemic struck, we're in the midst of New York City, and so we felt it very deeply. And we had to figure out what to do. We had a line of work. We're pretty organized in that way of what we thought we were going to be doing. And then we had to figure out how we were going to keep doing that, but still do these other things that were so important. So I think the first thing we did was to try to take two positions, to look outward and to look inward. So looking outward, we really reached out immediately to all of our grantees. So these are researchers, and they've got their plans and their timelines, and they're going to be collecting data, and then schools are closed. And then they don't know how to do this. There are no in-person meetings. So we just reached out to every single person and said, what do you need? What do you need? How can we support you? And really in the first few months or weeks of the pandemic, they didn't know, because there was this uncertainty about whether or not schools would be closed, whether or not they'd be able to reach out to children and families. And so we just said, look, just figure it out. You want to talk it through with us, we'll help you talk it through, but you need to just take some time and deal with what we know is not going to be clarity for some time. And they're pretty good. I mean, they were figuring out ways in which they could get interviews done. And so that was kind of interesting. I learned flexibility in a way that I probably should have a long time ago. But we also tried to use our communications area to figure out how we could do things that might support the field at large. And so we put out a COVID response resource, because, we support research, we like to share our findings, and people were really coming up with great ideas. So all kinds of organizations had resources out there, and if we could be at least a place where you could find a substantial amount of that in one shot, we thought that would be a good thing. So we did that. I think that was around May. And then by September, we realized that the conversation had now turned to this long needed conversation around race and social justice. And so we put out a few resources on equity, and that was really important to see the statements that people were making. AERA, Child Trends, the Center for Law and Social Policy, everyone, and our own, making these statements, as well as the collaborative that Rebecca and I belong to, really talking about the kind of social injustice and economic injustice that the early childhood workforce has been dealing with for a very long time. So those were our kind of out there trying to give grants as we could for folks who want to do research to see the impact of COVID on childcare workers. So we're doing this work with our grantees, trying to get them situated, sending out resources, and trying to make grants that would support people in understanding this period. And then internally, we had to take a look at ourselves to say, this is a very different moment than we had planned when we planned our year, but it's okay. And how do we make sure that our work is not tone deaf to this, that we are actually taking this moment as an opportunity? And so for me, I needed lots of check-ins because I couldn't see them. I think they got kind of tired of that, but I just needed to make sure everybody was alive and well. And so that was on a sort of social level. But I think it was trying to figure out, what does this mean for us? And so we started doing some internal readings. We have a very interesting staff. We have probably at least a 40-year age span across our staff. And so people had different perspectives, and they brought different experiences. And so we started internal readings that really had to do with the world around us, but really, what does this mean for our work? And so we've read Race Matters, White Fragility. Folks are about to read, and some folks reread, Between the World and Me. And I'm pushing Isabel Wilkerson's Caste as the next one. But it's not to change minds. It's not to get a discussion, a political discussion going. It is to see, what does this moment mean, and how does it really affect our work? What is it about the workforce that we can take a look at and say, there have been systemic barriers here that have precluded these folks from getting what they need, and that's in terms of compensation, but also in terms of the quality of services that they can provide and just plain support. So that's been a really important thing for us. And then just as folks who are, listening in who may be in the foundation world know, you've got to do something with the board. And so we had a board that was saying, oh my God, they're in New York City, they're having this drama. So for the first 13 weeks of the pandemic, I wrote at the end of each week an update on where we were, what we were doing, that was programmatic, that was, sort of the personal aspects of what this meant and how we were coping. And I think it was really helpful because I think they needed a sense of everything's okay in this crazy world, but that the work was going on and we were trying to figure it out. And as Rebecca says, we haven't, figured it out, but at least we understand that there is not going to be certainty for a while and our work will go on. So I'll stop there.
Declan, thank you. And we will dig in. It's a particularly interesting panel, and we chose you all three of you, carefully with this in mind, knowing that the workforce in particular is a kind of a common thread across all of your work. So look forward to getting into that in just a moment. But before we do, let's turn to Michael Weinberg, who is a great champion for young children in the state of New Mexico. And Michael, want to invite you to start us off and give a little background on the Thornburg Foundation.
Sure. Thank you, Dan and Javed and the Hunt team. I guess the benefit of going third is I could just say ditto to a lot of what Rebecca and Jacqueline said. I mean, I was nodding vigorously throughout most of what you were sharing. I was checking things off of my list. So it's encouraging. I think it shows that there are similar efforts out there. The other thing is I'd listened to some of the previous 3 installments and heard similar themes. So I won't go into a ton of detail, but I'll just say that this idea of what we were calling adaptive grant making has been true for us as well. The speed at which we're making decisions, this idea of converting grants to general operating support, flexibility around reporting, all of those things, reaching out to grantees. My hope actually is that this is one of those silver linings, that some of those changes will stick, that we've recognized these are just good. Doesn't matter what we don't have to be in a pandemic to try to be more responsive to our grantees. So I'm very hopeful for that. We did a bunch of what I would call emergency funding. So our foundation, it's interesting to hear you, Jacqueline, talk about the way that you focus on research, and Rebecca, that you're focused on policy advocacy. I would say that our emphasis has been around influencing policy at the state level in 3 primary areas, and I'll actually talk a bit more about that in a minute. We also do what I think of as like the traditional check writing philanthropy to local nonprofits. But during the pandemic, we contributed to a number of emergency response funds that were created, or we helped create emergency response funds. Those included everything from some food and ag work around building local food supply chains, a Native American relief fund. We did some direct COVID grant making to organizations, for example, that were working. I mean, it's strange to think back how much has changed, but organizations that were hand making masks, that was a big deal in those early days. We really increased our racial justice funding as well, and then we contributed significantly to the census count in New Mexico. Which is not exactly COVID, but it's something that has clearly been a hot and important issue over these past 6 months. The last thing is, as an early childhood funders group in New Mexico, there are around 6 or 8 of us who have pooled funds and tried to get them directly into the hands of early childhood providers. We made 62 grants to childcare providers, home visitors, and early interventionists. And those were really in the early days of the pandemic, to do things like buy personal protective equipment, buy additional cleaning supplies, buy the digital devices or technology to try to serve families remotely. Some of those just really basic needs. One of the things that we learned from that is that we're really not that great at getting money directly to providers. And so we're actually doing a second round right now, and we're trying to reach home-based providers specifically. And so we're working through intermediary organizations that do have relationships with networks of home-based providers. So those are a few of the changes that we've made so far, Dan. Thank you.
Terrific, Michael. Thank you. And let's get into sort of what I was alluding to earlier. I'll pose this question, Rebecca, to you, but with the knowledge that that all of our panel sort of has a connection to this. So Jacqueline and Michael will maybe ask you to extend on this later on. But one of the things that I think is kind of unfortunate about the pandemic is that a lot of the issues that we might otherwise be talking about in early childhood have been kind of put on the back burner, right? We've had this emergency response to COVID that maybe has rendered some of our traditional conversations maybe a little bit more mundane during this emergency time. But I'm not sure that really is the case with the early childhood workforce. I think the pandemic, if anything, in my mind, has really highlighted the needs of the workforce and the importance of the workforce, right? So we've had the early childhood workforce identified as essential staff by almost every state, if not every state. We've had them identified in the same category as firefighters and medical professionals, as first responders. We have parents who are dealing with something like virtual pre-K now, who over and over now are sort of expressing their newfound appreciation for the workforce and just what a challenging job it actually is to teach our youngest learners. And so I'm wondering, Rebecca, if you see, as someone who is really steeped in the workforce issues, an opportunity maybe coming out of the pandemic to realistically advance the ball on these early childhood workforce issues, now that maybe there's a little bit more of a spotlight being put on the field.
Yeah, thanks, Dan. It's a great question, and I have too many thoughts to share and distill into one webinar, and I hope that Jacqueline and Michael will chime in as well. But I think, a few things. One, you're right. We've seen a tremendous amount of attention paid to essential workers, and including a recognition that the early childhood workforce are essential, not only for the functioning of the economy, but also, we know that it's really important to have early childhood educators for the well-being and learning and development of young children, right? So it's a complex job. It's essential in a number of ways. And I see people having that conversation around both of those dimensions, probably more around the essential functioning of the economy and supports for families to get back to work right now than on the learning side, but both are important. And I joke with my comms team that they're probably sick of me sending them emails like, this grantee published an op-ed and this grantee published an op-ed and this research was right. There's just more just sort of press and media attention to this because it's a part of the national dialogue. And I think that's great. And we've seen some of that translate into actual policy. We did have some modest investments in the stimulus packages, for example, in CCDBG and home visiting. It's not nearly enough to stave sort of the stem the bleeding that's happening right now. Our workforce, as I'm sure many of you have heard, is sort of on the edge, right? We're somewhere between 30 and 70% of providers could close if there's not some robust support. And so So public will, public attention, media attention is great, and it has to translate into some more significant policy investment, right? And we've seen, as I said, a little bit of that. I hope if we get to a stimulus bill in Congress, that there is, significant investment in a child care stabilization fund, and then eventually we need more money in at least CCBG, if not other funding sources. So I think that's a conversation that we're having about the field and the workforce at large. With regard to teachers and program directors themselves, I started out as an early childhood teacher, and I've been thinking about this a lot lately. It's been 20-ish years since I was in the classroom working with young children, and I just still remember how difficult and tiring that job was, right? Just under the sort of best of circumstances at the time. And when I say the best of circumstances, like I was making $8 an hour. I worked for a program that actually provided health insurance, and I thought that was like an amazing gift. I eventually sort of had to move back in with my parents because you can't survive on $8 an hour. And I did not have access to the preparation that I needed to be able to understand the science of child development and work with children in sort of the best way that I wanted to, without incurring a lot of student loan debt, right? And so that was like not in a pandemic. That was not in the world that we're living in now. And so I want us to, as a society and as philanthropists and others on this call, really think about like the level of human suffering that is going on in the workforce, right? And so to me, that is just sort of a call to action to think about compensation, right? Not only a compensation floor that's a living wage for the workforce, but a compensation sort of bar that's at least on par with our K-12 colleagues, right? There's lots of conversations also happening around K-12 teachers, right? And lots of them are in unions, and lots of them are worried about their health and safety. We're not necessarily having that same conversation about the early childhood workforce, right? Much of our workforce has still been there providing care and education in person throughout the pandemic. Some of them have struggled to get PPE. What we do see from some of the research that we've funded through the collaborative and Heisen-Simons individually, through Walter Gilliam's study with his team, is that that early childhood programs are not contributing to the spread of COVID, in part because of that natural orientation towards sort of care and education and that care part that's sort of fundamental to early childhood programs, right? But we're also seeing that, as with the rest of the population, Latinx, Black, Indigenous providers are contracting COVID at a higher rate, right? So our discussion earlier about, the struggle for racial justice is also something that's very real in the workforce. So I think the attention is good. I'm really glad that we have people paying attention to the workforce in maybe ways that we hadn't before at such a large scale. And also, we need to think about doing things differently, right? So this to me is not just some of the federal policy and grassroots organizing actions that I talked about related to potential stimulus and other investments, but it's also working with states, right, as they face huge budget shortfalls, right, and communities, to think about how we rebuild these systems and actually fundamentally build them in different ways that stabilize the workforce, both in terms of compensation and preparation. So I'll stop there, and Michael and Jacqueline, I know you both have thoughts.
Good. Rebecca, I think that you raise such important issues, because I think you're right that on one hand we've got this renewed attention to the needs of the workforce, but the example that you bring up around the difference between how the K-12 workforce is able to lobby in essence for for themselves. I mean, the clout of the K-12 workforce to be able to say, we don't feel safe going back, so we're going to push for online education. Really has not reduced that risk. It has, in large part, shifted that risk to the early childhood workforce in many cases. And so it's been fascinating to watch. Jacqueline, I want to give you an opportunity. As Rebecca mentioned, Foundation for Child Development and Heisen-Simons have worked very closely together on many of these workforce issues, and I know Thornburg is looking at those as well. So I want to give you a chance to weigh in on this workforce question and maybe extend a little bit on Rebecca's responses, but also want to give you an opportunity to talk about the Young Scholars Program that the Foundation funds. This is a grant support for early career researchers in early childhood, many of whom are looking at workforce issues. And so, interested to know from your perspective, are there key findings that are coming out of the research that the Foundation is funding that we need to be keeping in mind as relates to the workforce?
Okay, I do have comments.
All right.
Thank you, Dan. Rebecca's comments sort of led me to this thought of a graphic that was published by the Center for the Study of Childcare Employment. And they were looking at the age of children, the ages, and the pay of the folks who work with kids. So K-12 teachers, that was our sort of, if we could be at parity. But let's be clear, K-12 teachers aren't being paid as much as they should be paid either. So we need to think about that. But the younger the child with whom you work, the less money you make. And as the children get younger and the pay gets less, the browner and the more female is the population of the workforce. And I've looked at that chart and thought, we've got to get some policy. It is a social justice issue. It is something we need to really understand why we've tolerated this in a business model, especially in childcare that's not state supported, that is impossible. So we have put people in a situation where we've said, you've got to get out there and get more degrees, and we really think that the work you do is important, but we're really not going to pay you any more money, and you probably will go into greater debt as you try to get a degree. This is an intolerable situation, and so we owe it to a workforce that has dedicated themselves to young children to figure out ways in which we can use their voices. Because while I fund research and I believe in the power of research, we also believe in the power of advocacy. And so we're looking at a lot more grassroots funding of advocacy organizations that really use the voices of people doing this work to empower that work. I think we have to take that look. So that's been an added thing. We too are looking at a state strategy. And so for the past 5 years, we've been working with the National Governors Association, the Council of Chief State School Officers, the National League of Cities, all of these folks to really highlight the early childhood workforce in their thinking at the state level, so that we can have this connection between research and policy. And I think one of the things that is so important for us as we fund research is that it's not research for research's sake. It's research to inform policy, to lead to better lives for children and the adults who care for them. And so when you speak about our Young Scholars Program, that has just a special place in my heart, because these are early career folks who are interested in early childhood. And we've said, this is great. Typically untenured assistant professor level, we will fund either primary or secondary research studies that look at some aspect of implementation research as you look at the early childhood workforce. And so we have studies trying to understand the role of coaching and trying to understand what kind of data can we collect that really does highlight the importance of the workforce and helps us to understand in a much deeper way the knowledge, skills, and dispositions that people need in order to do a good job. So we have our Young Scholars Program. We also have our New York City Research Network that is a research practice partnership. And we've come to really like these research practice partnerships because it is an attempt to bridge that gap between research and policy. It is an attempt to say, policy is really critical. And for most cases, the policymakers aren't really going to be using or reading the research studies that get published unless they have some meaning and some interpretation. So our attempt is to form a collaboration and a working relationship between policymakers and researchers. And we did this in New York City around their Universal Pre-K initiative, where we pulled together researchers and the city agencies running the UPK initiative and said to the policy people, not the researchers, what are the questions you need to answer in order to do a good job here? What are the questions you need to answer in order to engage in continuous quality improvement? Not to get a high score on a randomized controlled trial, but to really engage in continuous quality improvement. And I think it's been hard. It's not the way research is typically done. And so for our young scholars, as well as for our research network, and by the way, I think we're having some conversations around a research practice partnership with Hunt around the development of racial identity in young children. These are times when you don't have 2 years to do the research and then hope that the policy people will read the 40-page report. It's not going to happen. So how do we get those connections? And I think more and more we're trying to figure out how to bridge that connection. And our young scholars have done a great job of looking. There are 2 areas. We have a whole bunch of scholars who've been looking at children of immigrant families. Who knew 10 years ago that was going to be a really critical thing to study and understand? And these folks have come now to, as they mature in their work, to really sit before Congress and testify and give their research that speaks about the psychosocial implications of deportation and immigration on young children, what it means in the development of a child. And we hope that we will have that kind of body of research built up around the workforce so that we can speak with a degree of confidence about what people need, how we support them, what is effective. In this federalist government in which we live, there are probably going to be at least 50 different interpretations of what that looks like. But that's okay. I think context is everything. And as we push more implementation research that really looks at what is working for whom, under what conditions, I think we give more of a focus on the role of context in understanding how children are doing. I'm going to stop so that Michael has a chance to say something.
Good. Well, Michael, let's turn to you, and I'm gonna ask you, Michael, a question kind of in 2 parts, because I know in your portfolio at Thornburg, the workforce is a critical part of your work as well. So, part 1, I want to give you an opportunity to just sort of weigh in on the conversation that Rebecca and Jacqueline have started on the workforce and how you're seeing that play out in New Mexico. But the other thing I wanted to ask you was around one of your other priorities, and that is a well-managed and fully funded early childhood system for the state, because New Mexico has made some tremendous progress here over the past year and a half in the creation of a brand new early childhood education and care department that has consolidated programs into a single cabinet agency structure, but also an early childhood trust fund, which will, as it grows, create kind of a dedicated funding stream for early childhood in the state. And you referenced the funders group in New Mexico. I want to give you an opportunity as well to weigh in on the role that philanthropy has played in helping to advance the state in the way that it has in the past couple of years.
Sure. Thanks for the question. And Jacqueline, I didn't want you to stop talking. I was really enjoying hearing about the work, but I'm happy to take a shot at the question. What I would say is that as a foundation, each of you have talked about this as well, that you've developed strategies. Ours, and Dan, you referenced this, there were really 3 parts to it. One was, and it's very state specific, but we wanted to increase access to high quality early childhood programs. And that mostly means home visiting, pre-K, and childcare. Those are the 3 that we've focused on. The second was knowing that to do that, we would need to really help develop the early childhood workforce. So that is a great fit for this particular grouping of the three of us. And then the third is, as you mentioned, Dan, was how are we going to pay for that and how are we going to govern it? And I'm really using like the royal we in this when I keep saying that. It's our partners, our grantees who are doing this work. I did want to, you mentioned it, but I wanted to highlight a couple of what I would point to as policy wins over the last few years. I mean, one is just this idea of we've increased funding significantly by about 144% in 6 years. So there really has, and that has been during some challenging economic times and under both a Republican and a Democratic administration. We've had a gubernatorial change. So we've seen steady support for those programs. We created a new department that just went live in July that consolidated programs that were spread out across multiple agencies. So we're very hopeful about that system change. You referenced this trust fund that was created last year. New Mexico, as are a number of states, our revenues are highly dependent on oil and gas prices. So we see tremendous volatility, and the governor and the legislature saw this as a way to stabilize revenues. So in good times, we're socking money away into this trust fund. And then in lean times, like right now, we can begin drawing from that fund to support early childhood education. So those are some of what I would point to as the big policy wins. Where we are right now is largely around assisting with what I would call the implementation phase of some of those changes. So, one of our grantees is the United Way of Santa Fe County. They've been integrally involved with the preschool development grant strategic needs assessment and planning process, the Pritzker work that's going on in New Mexico. And so there's a lot of like in the trenches kind of stuff that's happening right now. Some of it has to do with, I mentioned this question of how are we going to pay for some of this. So one of the things that we focused quite a bit on is using Medicaid as a leveraged funding source. This is one of those, it's a positive, but we have a really high Medicaid match rate because of our poverty level in New Mexico. So we're using Medicaid to pay for home visiting and really trying to work with the department to help them figure out how to do that well, to expand that rapidly. The other thing that we're focused on quite a bit is exactly what the other two panelists, Rebecca and Jacqueline, have talked about. How do we strengthen our early childhood workforce? So we're working really closely with our community colleges, our branch campuses that are mostly awarding degrees at the associate's level. I saw a question that popped up in the chat box. We're doing things like trying to accelerate the time to degree completion. We know that for so many of those in the workforce, time is really the biggest barrier because they're working, they're also raising families. And so creating cohort models where we can remove as many barriers as possible is something that we focused on quite a bit. And then residency models is another approach that we're funding at a couple of those institutions. So how can they braid what they're doing in their coursework with what they're already needing to do for their literally their day jobs. And then the last piece is for so many of these, particularly childcare educators, they're already taking a series of trainings that are required through our state's quality rating improvement system. So how to start making those trainings count toward some of the entry-level classes that they'll need, whether it's for their CDA or to go on for their associate's degree. So those are a few of the things that we've been working on to continue to build the system in New Mexico.
Terrific. Thanks, Michael. And we've got about 15 minutes left in our conversation today. I want to remind you, if you have questions that you'd like to pose to the panel, please do feel free to pop those into the Q&A function and the chat, and we'll try to get to as many as we can. Also received quite a few by email earlier today, so we'll do kind of a speed round, open to everyone. I did want to raise. Catherine has raised a series of questions in the chat that I think are important. We're having a lot of conversation around the early childhood workforce in terms of teachers who may be caring for children outside of the home. But during the pandemic in particular, I think one of the trends that we are seeing is that, whether it's in childcare or in K-12 education, the number of families even choosing to access group care is definitely declining, probably in the short term, but maybe for a longer term. Curious to know from any of you about any supports that the foundations are providing to help to support the parents and their key caregiving roles for young children.
So we haven't done direct supports to parents, but we do feel that if you think about what teachers need to know and be able to do, one of the critical aspects of that is understanding how to create partnerships. And they can be partnerships with other teachers, other professionals, but they have to be partnerships with parents. And what we see so often are teachers who have a very superficial notion of what that partnership should look like. If you come in, I'll tell you some things about your child, and that's not the partnership. That is everybody owning this. And I hear as I look at parents saying how amazing these teachers are and how tired they are of doing this work. We're not expecting parents to be the professional educator. And so I think that connection is something that we think is really important. We funded the parenting study that was done by the National Academies that really did look very carefully. And so if anybody wants to go to the National Academy's website, parenting report, I think Vivian Gadsden, one of our board members, was the chair of that committee's consensus study, pulling together the research we know around parenting was really helpful. But in this pandemic, I think it calls for teachers to have a very strong ability to connect to parents, to connect to communities, to really know the children. And so you can't just have a notion of a class. You've got to know these individual children because they're in their homes with their parents. And I think we have some more work to do helping teachers to make those kinds of connections, understanding the importance of those connections, and really figuring out a way in this semi-virtual environment to make it all work. We shouldn't expect parents to come in with this great knowledge of how to do it. That's not what they do. They provide another kind of support, an extraordinary kind of support for young children. But how we form an educational partnership, I think, is something that we need to really figure out and help teachers to get a good handle on and make it a really important part of teacher preparation programs.
Anyone else want to weigh in on that one?
I'll just quickly say that this is an example where I don't think that we as Philanthropy are that great at directly supporting parents. I mentioned before, even our attempt to connect with home-based childcare providers, I'm saying our early childhood funders group, we saw that as a tough bridge to cross in our traditional model of funding. I think that a lot of times it comes back to this idea of two-generation models. I think home visiting is, when it's done well, is providing that support directly to parents. Getting to some level of universal home visiting is a big goal. I think even high quality childcare or Head Start would hold themselves up as being two-generation models that are meant to directly support parents. So that's how I would respond to that.
Great.
And I would just,
Oh, go ahead.
Dan, just quickly echo what Jacqueline and Michael have said about sort of the role of philanthropy here, as well as the role of families in the lives of children and that centrality and the need for deeper linkages between families and educators. And just want to mention that, not in my portfolio, but the foundation has a history of funding both in family engagement, both research and practice, as well as deep engagement in the home visiting policy space. And so I think my colleagues, Holly Kreider and now Malia Ramler, lead that work and could speak to it more specifically than I can, but want to echo some of the sort of value statements and then sort of self-critique and exploration of what philanthropy has and could do around this issue.
And Dan, if I could, I think we talk about early education as though it is the panacea. And yet I think we need to take a broader look, because if we are to be a country that really has an organized and coherent policy around young children, we are talking about parental leave. We're talking about earned income tax credit. We're talking about education. We're talking about being able to make sure that every child has access to the care that they need. So I think maybe one of the things that philanthropy can do is to lift up the complexity of this and the interrelatedness of lots of different issues here. Because it's not just that we should be able to provide early care and education, which we should be to every child, but we should also be able to give parents that opportunity to be with their young children when they want to and they can. And we should also make it possible that they can get some kind of income tax credit. We just need, I think we need to just overhaul the entire approach, because it's not really an approach. It's not a coherent policy. So maybe our goal is to make it coherent and comprehensive.
Interesting question here. It's a fitting that with those of you on the line that we should have some questions about research. And so, Jacqueline, whether through the Young Scholars Program or I know, the Early Educators Investment Collaborative that you all have collectively been involved in has done some work here recently with higher education. So Callie has a question, says, I'd love to know what the panelists think about specific issues or gaps in early childhood teacher preparation, and if there are any emerging trends that you see as important for further research.
Rebecca could talk about an initiative that we know about.
Yes, absolutely. And I apologize if you hear my dog barking in the background. That's the joy of Zoom. Yes, so the Early Educator Investment Collaborative, which is a collaborative pooled fund of 8 early childhood funders, is totally focused on the workforce. And I can direct you to our website to learn more about our vision and mission, just recognizing the time here. But we have released an RFP that was targeted at institutions of higher education across the U.S., both states, territories, and in tribal nations, to really foster innovation in rethinking how we structure teacher preparation, particularly focused on lead early childhood educators. So what we did was ask applicants to really think about their sort of non-system of teacher preparation, think about what the barriers were that existed, not only sort of the typical barriers that we think about around sort of financing, and I want to acknowledge that a lot of you have asked like really good questions about our financing system overall that we might not have time to answer today. But, really thinking about some of the barriers that exist sort of around structural racism, systemic oppression, right, that our early educators face, and then to really propose a redesign of either a component of their teacher preparation system or overhauling the entire thing. We asked them to partner with community colleges, with, at the very least, the state agency or tribal nation entity that governs teacher licensure, and encouraged partnership across the system, recognizing that, from a governance perspective, early childhood is really siloed and fragmented, and so there might be multiple agencies that you need to partner with. And so some of that is, we received an overwhelming number of applications, more than we can fund, but we thought a lot of them were really interesting, and they represented both energy and momentum and a desire on the part of both institutions of higher education, but also sort of the state or territory or tribal nation governmental entity to engage in this fundamental change. And I think part of it will help us identify research questions and a research agenda, and then also sort of offer opportunities for us to perhaps evaluate and create learning communities across states to really think about this question of teacher preparation and compensation. So it's not a research agenda per se, but I think it will help us sort of flesh out a potential research agenda for the workforce, right? And like from a broader perspective, we do have questions about the workforce still, this sort of notion of dosage, of what it looks like, what is sort of the secret sauce in, for example, a 4-year degree program, right, that gets you to the competencies that you need to be what we would think of as a well-qualified early childhood teacher. So there are lots of research questions, but what Jacqueline mentioned is highlighting, I think, an opportunity to engage in some experimentation at the state level, taking a systems approach, taking an approach that recognizes that there are structural barriers from a racial and income disparity perspective that states and higher eds need to work to overcome, right? The responsibility doesn't lie with the early educator, right? It lies with the institutions that have the privilege to change sort of the rules of the game. So I think those are some things that we could evaluate down the line once we've issued the funding. And Jacqueline, I don't know if there's anything you want to add to that.
The only other thing I'd say is, as we think about research questions, what are the knowledge, skills, and dispositions that lead to outcomes, good outcomes for children? And I think we have a hunch, we have certainly tradition, but to get good data that really says what those are, I think that's a research opportunity.
Great. Our time is starting to wind down, but Michael, I wanted to quickly ask, I have a question that I feel that for you in particular, that is, I think, New Mexico specific, but really probably pertinent to states all over the country. The question is, New Mexico is a very rural state. Are you seeing any differences in the challenges that are being faced by childcare in rural and urban communities in the state during the pandemic?
Yes, we are. And I think that one of the things, I keep bringing up this idea of the home-based childcare provider in our state. We know that there are certain areas, some rural and actually some urban, where that is, it's always been a critical element, and it's become even more important during the pandemic, largely because of family preferences around safety, I think, and saying that they would rather have their child in that type of setting than a larger center. So that's one aspect that I've seen. The other is gosh, we're right at time. We have a mixed delivery pre-K system, and what we know is that whether, again, it's rural or urban, but in some rural settings, the private childcare providers or community-based providers are the ones who are essential to delivering pre-K. And so how we continue to support them through the pandemic has become more important.
Great. Well, we are just about out of time, but I want to ask one final question, and maybe you can each take maybe a minute to to respond, but one of the things that we have asked across this series as sort of a closing comment is, what do you see as the greatest opportunities for creating a more just early childhood landscape that addresses really the structural issues that we are seeing today? So I wanted to give each of you an opportunity to quickly weigh in on that. Jacqueline, you want to start?
Sure. I think and I'm going to take this from a research perspective. I think one of the things that we have an opportunity to do is to change our research model from simply looking at the gold standard of randomized controlled trials, which I think are wonderful and give us very good evidence, to adding into it much more contextual data to understand the conditions under which interventions are posed, to understand who's getting the particular kind of intervention, to understand the role of teachers and other professionals in this implementation. I think that is critical to understanding how distributed the treatment is and to whom, and how it's getting better. I don't think we can go on and think we understand how programs are working unless we take a much deeper look at the context.
Great. Michael, you want to weigh in?
Sure. I'm feeling the pressure of like the presidential debates where you have that 1 minute at the end, and I just used 10 seconds to say that. So what I would say is that it's really just echoing what we've been saying this whole call. We're focused on the workforce right now. I expect we will, in New Mexico, have a piece of legislation this upcoming session that really targets a career ladder and compensation for at least childcare workers, educators, perhaps home visitors as well, but specifically addressing some of the challenges that we've brought up today around that pay disparity of those teachers who are working with ages 0 to 3 and some of the rural providers. A couple other things around our pre-K compensation, and then just use of data around the workforce. So that's what I see as a structural change that is on the horizon in New Mexico.
All right. Rebecca, you want to close this out?
Sure, thanks. So I think it's time, in particular for philanthropy, but for us as a society, to really listen to and follow the lead of those people most affected by a particular issue, right? So in this case, we're talking about early childhood, we're talking about the workforce. We really need to listen to the early educators themselves and families, as we've talked a little bit about on this call, and think about the opportunities to, we have a lot of people in this country who are really mobilized right now because they're affected by the issues that we've been talking about on this webinar. And we can learn from other movements, right? The labor movement, some of the movement for racial justice. There are others that I could mention, but how do we sort of move the agenda for kids, families, and the workforce intersectionally? And how do we do that sort of by supporting a grassroots organizing movement? I think it's well beyond time that we think about that. And if we can think about, right, like to my point earlier, like the level of human suffering that we are willing to tolerate as a society and what the social contract is around that, we really need to take a hard look at, the people who have been identified as essential in this pandemic are the lowest paid people in this country, not just the early childhood workforce, but others. And so we really need to, I think, rethink that and take our lead from those folks.
Wonderful. And with that, we will start closing out. I want to begin by just thanking Dr. Rebecca Gomez of the Heisen-Simons Foundation, Dr. Jacqueline Jones of Foundation for Child Development, and Dr. Michael Weinberg of the Thornburg Foundation in New Mexico. But as importantly, I want to thank all of you who spent the hour with us. I know there is a lot of online programming happening right now, and that you continue to take time out of your busy schedules to participate in the early childhood programming that is offered by the Hunt Institute means an awful lot to us. We do want to alert you to 2 upcoming events. One here that I think is about to pop up on the screen is going to happen on Thursday, December 8th. if we can move to the next slide, there we go. I'm sorry, not Thursday, Tuesday, December 8th, at 2 o'clock in the afternoon. Rebecca mentioned earlier that maybe in the next couple of weeks, we'll start to have some sense of kind of the direction where at least certain things in the country are headed. So we'll be talking on December 8th about the 2020 election and what its results mean for early childhood policy as we go into 2021. We're very lucky Samir James, the interim president and CEO of the National Black Child Development Institute, Katie Ham, vice president of early childhood policy at the Center for American Progress, and Sarah Rittling, the executive director of the First 5 Years Fund, three super minds when it comes to federal policy and early childhood in this country. We're so lucky to have this panel joining us on December 8th to help us think through what do the election results mean for young children, regardless of how the election turns out. We're going to think that topic through with this great panel on December 8th. The other thing I wanted to mention to you, we do not have a slide to display, but just as a heads up, recently at the Reagan Institute's RISE Education Summit, we had the opportunity, our CEO, Javed Siddiki, who was with us earlier in the hour, moderated a wonderful panel discussion with our chairman, former North Carolina Governor Jim Hunt, with Phil Bryant, who is the former governor of Mississippi, and with Susana Martinez, who is the former governor of New Mexico, about early childhood. We are going to be participating in an encore performance of that. We'll be showing that session from the Reagan Institute with a little bit of new live response that day, but hope that you will make plans to join us at 2 p.m. on November 23rd as we revisit that session from the Reagan Institute's RISE Summit here this year. So with that, I know we're a little bit over time. Thank you for joining us. Panel, thank you. It's been so great to talk to you, and we look forward to seeing everyone real soon. Bye-bye.